Hello and welcome, this is Dennis Whiskers from Whiskers Educational Materials, that's vemonline.net. Today we are gonna talk about lateral line. In our previous lectures we discussed anterior oblique system, posterior oblique system, and deep longitudinal line. First of all, let's review what exactly is inner unit and what exactly is outer unit. Let's start with inner unit. Inner unit consists of multifidus muscle group, transversus abdominis muscle from anterior lateral aspect, diaphragm from superior aspect, and pelvic floor muscles from inferior aspect. In our previous lectures we talked about anterior oblique system, posterior oblique system, and deep longitudinal line. All these are outer unit systems. Anterior oblique system, posterior oblique system, and deep longitudinal line system. Today we are going to talk about lateral line system. Lateral line system consists of adductor muscle group, same sides gluteus medius muscle, same sides gluteus minimus muscle, and contralateral sides quadratus lumborum muscle, as well as internal and external abdominal obliques from anterior aspect. Lateral system is very important for balancing on one leg. Lateral line system also plays very important role in pelvic stability and spine alignment. In previous lectures we talked about anterior and posterior oblique systems, as well deep longitudinal line, which is going to be compensation system for posterior oblique system. Similar to anterior oblique system and posterior oblique system, lateral line system draws necks across pelvis. One side's quadratus lumborum muscle, opposing sides gluteus medius, gluteus minimus, and adductor muscle group. Dysfunction of lateral line system almost always results in gluteus medius weakness. This can be easily assessed with positive Trendelenburg sign, which means if we flex one side's knee, so right side's knee is going into flexion, so knee up on the right side. Pelvis is gonna drop on the same side, so we will observe right side's pelvic drop. And this is essentially happening because opposing side's gluteus medius muscle is unable to keep the pelvis parallel to the ground. Often with this scenario, opposing side's quadratus lumborum is gonna develop trigger points. To sum this up, lateral line system, LS in short, is going to check pelvis stability side to side. With inefficient lateral line system, we will observe swaying gait. That's basically how the models walk. With every step, let's say we are lifting right side's foot off the ground, pelvis is gonna tilt towards the same side. And same will happen if we lift the left side's foot off the ground. Pelvis is gonna tilt towards the left side. Lateral line system dysfunction usually will lead to such conditions as greater trochanteric bursitis, which means that, let's say, if we are lifting right side's knee, pelvis is dropping towards the same side, and tendinous attachments of gluteal muscles are going to be snapping over greater trochanter of the femur. Iliotibial band syndrome, IT band, where this condition is often referred to as runner's knee. And with this condition, patient is usually gonna experience pain over lateral sides knee. And as well, functional scoliosis. If we're lifting right side's knee goes up. We will observe C curve on the opposing side. As opposing side's gluteal muscles are not going to be efficient enough to keep the pelvis parallel to the ground.